Hello everyone, welcome to chapter 12 organ function test. In medical practice, doctors do not only look at symptoms, they also confirm with lab tests. Organ function tests help us understand whether organs like the kidney and liver are working properly or not. In chapter, I will mainly focus on kidney function test, liver function test, and the final lipid profile test because these very common test hospital or clinic. Let us understand what we will learn today. First, we will start with the kidney. Why the kidney is important? What is does and what does tests are used to check kidney performance? Then we'll go to the liver. What the liver does and which test show liver impaired. Well, blockage or reduced liver function. Finally, we will study lipid profile, which tell the level of fat in blood and help assess risk of heart disease. By the end, you should be able to understand why test is order and what abnormal value usually indicate. Now let us begin with the kidney. The kidney are like the body natural filters. Every minute blood flow through the kidney and they remove waste substance and extract water. This is how urine is formed. If kidney become weak, waste products like urea and creatine start building up the blood. This can lead to symptoms like tiredness, swelling, reduced urine output, and high blood pressure. That is why kidney function tests are very important. In general, organ function tests are laboratory tests used to evaluate how well an organ is performed. They can help in their situation first diagnosis to detect disease early. Second, severity to how bad the disease is. Third, monitoring to see whether treatment working or not. So organ function tests are not only for finding disease, they are also for follow-up and long-term control. This slide shows the kidney structure even if you do not remember every small label. Remember the big concept. The kidney receives blood through the renal artery, filter it and produces urine. Inside the kidney there are mainly renal filtering unit called nephrons. Which nephrons work like a small filter, so kidney structure support kidney function, filter blood, remove waste, and maintains balance. This slide shows the urine structure. The kidney, uterus, urinary bladder, and urethra. The kidney form urine. The uterus carries urine to bladder. The bladder stores urine. The urine urethra releases urine output the body. This helps us understand that urinary symptoms like frequent urination, pain, reduce urine catches at different level. But the kidney test specifically tell us about the kidney filtering function. Now we started with kidney function tests. The kidney function tests are commonly ordered in conditions like diabetes, hypertension, swelling and leg fatigue can suspect kidney infection. These tests usually include blood tests and urine tests. Blood tests show whether waste produces an accumulation. Urine tests show whether abnormal material like protein, blood, or sugar are leaking into the urine. The slide maintains lung function tests. This point there It's to understand the general concept. Every major organ has function tests. For lung, doctor use tests like perfumetry. For a heart ECG and MCM may be used. Similarly, for kidney and liver, we use specific lab tests. So organ function tests to for different systems based on clinical need. The slide talk about gastrointestinal function tests. Again, the purpose is to show that function tests are not limited to kidney and liver. For digestion related use, there are stool tests and other investigation. So overall function tests help doctor confirm what it is happening inside the body. This slide again shows the kidney structure. The repetition is useful because in strengthening understanding. When you think about kidney disease, remember that kidney problems are mainly about filtration, water balance, and electrolyte balance. So kidney function tests are designed to check these three areas. Now we learn the function of the kidney is clear. The kidney removes the waste products like urea and creatinine. It maintains proper amount of water in the body so that blood pressure and blood volume stay stable. It controls electrolytes like the sodium and potassium. The kidney also help maintain acid-base balance by controlling bicarbonate and hydrogen ions. So kidney function is not only about urine, it is about keeping the internal environment stable. Now an important point. The kidney also makes the hormones and erythropoietin species, stimulating the bone marrow to produce the red blood cells, so in chronic kidney disease. Erythropoietin becomes low and patients often develop anemia, mainly low hemoglobin. That why kidney disease patients often feel weak and tired. Now we focus on ionic balance. The kidney controls sodium, potassium, chloride, bicarbonate, phosphate, and calcium balance indirectly. If kidney fail, potassium can reach and catch dangerous heart rhythm problem. Acid can accumulate and catch metabolic acidosis. So kidney failure is serious not only because of waste accumulation, but also because electrolyte and pH balance become abnormal. Now we come to kidney function tests properly. The most common tests are serum creatinine, blood urea, GRF, estimate filtration rate, urine analysis, protein, blood sugar, etc. These tests are used together, not separately, because each test give one part of picture. Now we study the GFR. GFR means glomerular filtration rate, which is the volume of fluid filtered by kidney per minute. Think of it as how much filtration work the kidney can do. If GFR is high and normal, kidney are working well. If GFR become low, it means filtration capacity is reducing. Doctor often estimate GFR using the creatinine age body of size and sometimes the gender because measuring the GRF directly in the fluid. Now we study the serum creatinine. The creatinine is produced naturally from muscle metabolism, healthy kidney removing creatinine easily. When the kidney filtration reduces creatinine into blood and the level reaches so high creatinine usually indicated reduced kidney function. But one important note, muscular big people can naturally have a slightly higher creatinine, and very thin people can have lower creatinine. That is why doctors prefer to interpret creatinine together with GFR and symptoms. Now do the check what abnormal kidney result suggests. If creatinine and urea is suggests to reduce filtration. If urine show protein, it suggests kidney filter damage. If urine blood show blood, it can indicate kidney infection, stone, and inflammation. If urine show glucose, it may suggest diabetic. So urine tests are like a window into kidney health. Now we understand why kidney tests are clinically important. They can help detect really kidney damage in diabetes and hypertension. They help monitor chronic kidney disease project. They helping adjust drug dose because many in medicine are cleared through kidney. If kidney function is low, normal drug dose may become toxic. So kidney tests guide but the diagnosis and safe drug use. This slide again emphasizes creatinine. One more simple understanding, creatinine reads slowly, so it is more useful for chronic kidney assignment. The sudden this can indicate acute kidney failure. Doctor compare present creatinine with previous ULV is to check whether it is active or chronic. Liver function test. Now we move to the liver. The liver is like the body chemical factory. It is processes nutrient absorbed from food make the protein. The free truck produces bile and convert harmful ammonia into urea. Because the liver does mean that liver disease can affect digestion and blood protein immunity and even brain function in several cases. Now the study of liver function is simple word. The liver control metabolism of carbohydrate, protein and fat. Store glucagon and release glucose when they needed. They produce many protein like albumin and clotting factors. So liver support blood stability and nutrient handling. Now we continue liver function. The liver produces bile and bile help in fat digestion and absorption. The liver stores vitamin like A, D, B12 and mineral like iron. The liver detoxifies drug and alcohol. It also converts to toxic ammonia into urea, which product to the brain. The liver failure affects mainly body system and once. This slide talks about the picocytosis and the copper cells. The liver has immune cells that remove bacteria and old cells from blood. So the liver also act like a cleaning organ. When liver disease cleaning function becomes weak and infection risk can increase. This slide shows the liver diagram. The liver receives blood from the intestine through portal vein. That means whatever we absorb from blood, food first goes to the liver for the processing. The liver is central to metabolism and the liver tests are important. Now we will study the liver function test. Liver test usually check liver cell inside like hepatitis. Bile flow observation like jaundice due to the blockage. Protein synthesis ability like albumin production. So liver tests include bilirubin, ALT, AST, ALB and albumin. Now this is the albumin. Albumin is a protein made up by the liver. It is maintains blood osmotic pressure and transport substances like fatty acids and drug. If liver become weak in producing protein, albumin level decrease. Low albumin can cause edema and poor killing. Albumin changes slowly, so it reflected chronic liver test, not sudden damage. Now we study the ALT and AST. These are enzymes inside liver cells. When liver cells are damaged, these enzymes leak into the blood. ALT is more liver specific than AST. High ALT and AST usually causes hepatic drug toxicity, alcohol damage, or other liver injury. In simple words, high ALT where AST means liver cells are irritated or injured. Now we understand the clinical significance of liver test. Liver tests help diagnosis hepatic fatty acids, cirrhosis, and bile test observations. They help monitor important after treatment. They also help monitor drug safety because medicine can harm the liver. So doctor regularly monitor liver tests. If patient taking create a long time medicine. Lipid profile test. Now we move to lipid profile test. Lipid profile is not blood test, measure fat and blood. It usually include total cholesterol, LDL, HDL, and triglyceride. Lipid profile important because abnormal lipid levels increase risk of heart disease, stroke, and blood vessels blockage. Now we understand LTL and triglyceride. LTL is called bad cholesterol because high LTL blood cholesterol is blood vessels and form the plaque for a time plaque narrow then vessels and reduce blood supply to heart, brain or limbs. Triglycerides are another type of blood fat. High triglyceride and also increased heart rate stability. HDL is low. Now we understand HDL. HDL is called blood cholesterol because it carries extra cholesterol from tissue back to the liver for removal. Higher HDL is usually productive. Lipid profile help doctor get that lifestyle advice like the diet and exercise, and it's also help in detect medication like the strains. Finally, lipid profile is also used to monitor after a certain treatment like staining. The doctor repeated lipid profile after a few weeks or month and check whether LTL has reduced and whether triglycerides are under control. So lipid profile is not only for diagnosis, but also for tracking improvement and preventing future complications.